Well, am I moving? There we go. All right. Gratitude Day, everyone. And for those who've been bearing with me, for those who was wondering what was going on, the little technical difficulties we had, I apologize for that.
Little.
Okay. Well, like I said before, the name of the show is Dream Big Dreams, and this is the third episode. And the Dream Big Dreams series has not as much to do with making a lot of money and acquiring a lot of things, but listening and being inspired and motivated by people who are doing some extraordinary things, by people who are living their lives and their purpose on purpose, contributing to our communities and to the world, and just giving service. And so today my guest is someone that has been called Mr. San Diego by some of my colleagues. He is a best-selling author of the book, Tell Me No, I Dare You. It's an incredible book. He is a recipient of the CNN Hero Award. He actually has a day in San Diego. He's a crisis coach, and he is the CEO of Confidential Recovery. He's someone that I've been able to call him for support, for advice, and a lot of just real talk because he tells it just like it is. Everyone, welcome my guest, Scott H. Silverman. How you doing, Scott?
I'm great, Charles. Really nice to be here. And by the way, you lied to everybody. You didn't have a little technical difficulties. We've been working on this for 30 minutes, and I say it's funny. Just I can't even do what you just did, connecting to Facebook Live. So it's really nice to be here. It's good to see you, man. Going back, I don't know how long ago did we first meet.
15, 16 years.
Yeah, and all I've done is when I watch you and how you personally develop what you're doing and your growth, it's just it touches my heart, and I think it shows others that doesn't matter where you are. If you set some goals, you make some plans, and you're willing to work at it, it always happens the way it's supposed to. It takes a little longer than we think, but at the end of the day, the journey is certainly worth it. So great to be here. Good to see you, and I'm here to answer any questions you have.
Great. Well, like I said, I believe that during this pandemic right now is actually a really good time for people to sit back and reflect and sort of reinvent themselves, do things that they've been wanting to do. If they wanted to start something new, maybe a new career or whatever, new studying and things like that, make their dreams and their visions come true. However, one thing that's stopping a lot of people isn't just fear, but it's abuse, substance abuse. People who are self-medicating, whether it's legal drugs or illegal, it's stopping a lot of people. And Scott, I know you are very committed to helping people.
Right. Well, and it's interesting that you mentioned that these times it's left us all with this interesting dilemma that, some of it we can control, most of it we can't. The stay-at-home orders, the morbidity rate just going on with the pandemic, losing family, the catastrophic events, and I like to think that I can stay positive about it and try to find the light and the good things that are going on. And I've been hunkered down since the first week in March. We were one of the first groups that thought we were at an event and we were exposed to somebody. So we, err to the side of caution, and my wife and I have pretty much been homebound since then and have had to adjust. I mean, I'm real lucky. I got a close colleague, Jay at Confidential, who, he's younger than me, so he can go in the office and take care of clients and work on that. And I'm virtually available, but it's a game changer. But, you mentioned earlier how you've grown a lot, learned a lot. And what I've learned is this kind of communication, I go to my own, personal home groups. I'm in recovery long-term. And I've found this to be fascinating and also informative and also unusual and also easy to get to, meaning I don't have to get in my car. I don't have to drive. I always argue about my home group and OB where parking's always tough, but it's created some opportunities, and we're really, working on how we can use telehealth right now with helping people, kind of dial in easily from their living room or their garage or their shed. That's where I work from. I have a shed outdoors. They keep me out there. I call it the clubhouse, so it's a little more fun. And it is an opportune time to do that. But it's sad to watch the unemployment, watching businesses shutter right now. And I just went and got my vaccination finally the other day, not finally, but got one. And I was on the tier that, because I work in the business I'm in, and then find out this week that, they may not, some of the doses are not contaminated, but they're not good. They've had some bad reactions. And so I may not get my second dose, but I'm not going to worry about that right now because I'm pretty much in a safe environment. But I know it's tough out there for people. And I want, look, you're out there right now. I'm going to throw my phone number out, 619-993-273. And I dare people to call me, 619-993-273. We'll see how big your audience is, Charles. We'll know really quick. Call or text me. Asking for help is 3 of the hardest words one can say out loud. But you know what? There is hope. There is help. And there's a path that everyone can get on right now if you're not happy with the one that you're on, or you feel like you've kind of been dealt, because you always have options, you always have opportunities, and again, there's always help and hope. So that's kind of where my head's at today, Charles. And again, watching you do what you're doing right now, and the fact that we're sitting here on Zoom, and I've got my backdrop and you've got yours, and we've got microphones, and we're, this is a virtual opportunity. And I know you're recording it, that we can punch it out to anybody. And what Zoom has done, in my opinion, not thinking about it before, has opened up the whole world right now. I mean, I can help people with my crisis coaching in any part of this country by phone, by Zoom, and be a resource to them where it wouldn't really be thought of, and I do interventions through Zoom. So there's lots of opportunity. And whenever I go on, KOSI, which I'm a subject matter expert around my topic, I get phone calls from families. And the one thing I hear consistently is, I don't know who to call. I don't know where to go. I don't know where to start. But raise your hand. I need help. It's out there.
Right. Hey, thank you so much for letting everyone know that. I know I read somewhere, I believe you said it could be a crossroads or it could be a cliff. And right now, do you see that there are more people during this pandemic? I'm probably answering my own question, that are self-medicating?
Well, and it's interesting. I think the crossroads are kind of coming together at the edge of the cliff. So it's not just a simple decision. Do I go left? Do I go right? But when you're teetering and you're wondering, am I going to fall off this cliff? It's easy to just surrender, close your eyes, and fall. I mean, that was something that happened to me back in 1984. I was at the end of my rope. But yes, things are worse because most of us who suffer, like myself, from this disease of addiction, we're not real good being alone. And when you're depressed, upset, anxious, sleep deprived, or gaining weight like I am during this situation, our self-esteem comes down a little bit. And if you're not reaching out for help, help doesn't normally come knocking on your door. I mean, even with a strong spiritual tie and connection, sometimes it doesn't happen in your time. So yes, and science showing that, we know that addicts and alcoholics, people that self-medicate, I mean, when they isolate, it's a very sad and not a positive environment, because we're kind of left with who we are. I remember once in early recovery, I talked to my group and I said, I'm going to go they said, you should go for a long walk. And I said, well, what if I get bored? And they go, well, consider the company you're keeping. So being alone is not a good thing, especially in this environment when things are happening. We're wearing masks, we have to be careful. We have to social distance. We have to, let alone what's going on in the news with our government. So it can be a tough time. And I don't care who you are, how well you manage, how much self-care you practice. This is not easy, and it shouldn't be done alone. And there's people out there that want to help, and friends and family. Somebody said to me the other day, I'm really missing my mom. I said, have you thought about, they lost her a couple of years ago. I said, what about writing her a letter? Something simple. Just write your mom a letter and tell her how you feel and what you're doing. Don't mail it. I use a God box, so I put my messages in the God box. So there are tools out there, but if you've never been through something like this, how do you know what you don't know?
Oh, you're absolutely right. And I like that God box. I actually, in my last book, The Fire Within 30 Days to Success, I speak about those letters. But Scott, there's one other thing. I don't want to ambush you with this, and I haven't really spoken to you about it. But
Bring
I
it.
was looking
Bring
at,
it. Come on. Let's see it.
you know, I'm coming. I was, I was on YouTube, and I saw a YouTube advertisement, and it was about, I think the title was "Ending the Stigma: A Path to Recovery." Is that still going on, or can you tell me anything about that?
Well, thanks for asking. Actually, it's launching in February. I'm working with this gentleman back east, and we kind of found each other through a third party on this podcast world, and we're going to be doing a live show. And he's pretty much technically setting it all up, and I'm just going to zoom in, and myself and Fred and Jen, we're going to be taking calls, answering questions, and I'm real excited because this is a platform I've not been involved with before, because I've always, I love the idea of the interview format. I'm not one of those and I'm a talking head and a rainmaker, but I'm not somebody who can necessarily sit down and spend 30 minutes talking on YouTube. And me, I could talk, Charles, but I like the interview, the interaction. So, and I don't want to sit and talk for an hour because I don't even know if the audience that I'm talking to is getting anything from what I'm saying. So the idea of this template and this format that he's created and we've talked about is about people calling in and just saying, hi, I'm here in Wycombe County, Kansas, and I have a son that's got an issue. What do I do? And try to walk them through it and then get them off with the producer and see if we can show them how to navigate in their community to get access to expertise of different kinds, and also access to information and also resources on how to get their loved ones support and help. So that's always been my dream. And that's, the whole idea with family navigating and crisis coaching is really help the family help their loved ones get access to help. And if I can't help you, I will show you how to get help. I mean, I'm not a magician, but every county's got resources. Every community's got ideas. Every different parts of any, part of the county and the country have got resources out there. So we really want to be a resource to people, especially those who have no idea how to navigate this. I mean, all of a sudden you discover your child has, illicit substances in their room, and you now know why they haven't come out the last couple of weeks. And with kids at school this last year, I mean, not being able to get to school, there's been some real changes in the environment at home. So I have this thing, I call it funeral avoidance, Charles. I don't want to go to funerals anymore. So anything I can do to help leverage the information sharing, I want to do it. So I'm excited about that. And it is reducing the stigma. So it'll be launching in February, and we're excited about it. We're working on content now, and we'll see where it goes.
Thank you. Thank you. I know it's going to do great. And I know you, I know your compassion. I know you're really authentic, and you are there to help. I know because you've helped me, and you continue to do that.
Yep.
Right now, I'm noticing that there is a lot of substance abuse, and I think, I don't know if the death total has really risen during this pandemic as much across the U.S., but I know it must be really high.
Right now in San Diego, the opioid overdose deaths have increased by 100% over last year. Now, this is going to sound strange when I say it out loud, but that's 3 a day. And 3 a day doesn't sound like a lot, but in a community like ours, being a border town, pretty smart, very sophisticated in some ways not, casual environment, Southern California, San Diego. But if it's doubled from a year ago, and this data is about 4 months old, with, the pandemic, it's got to be greater. And that's just opioids. Methamphetamine, I was just talking to some folks the other day, experts in the field. Methamphetamine 10 years ago, speed in San Diego was about $12,000 for a pound of speed. Pretty pure. Maybe it was about 60% pure is what they told me. Here we are 10 years later, 2021. That same pound of methamphetamine is now $1,200. And it's over 90% pure. So it's 10 times less in money, and it's about 30% more potent than it was 10 years ago. So that's just methamphetamine, and that's pretty much manufactured in what they call super labs in Mexico. So it's scary to think about the fact that we as America, we're targeted, we're a pill-oriented society. So imagine you're at a global conference as a drug manufacturer, and they don't really have these, but they talk to each other because they're competing, and they're saying, well, where do we target our distribution going forward in 2021? Well, look at the disarray that our country's in right now. Look at the division we've had with what's going on just politically, and the fighting between across the aisle and all the different issues. No matter what position you take, the level of angst that we've had this last year on a variety of levels has been pretty horrible. And again, most people want to anesthetize themselves. No one really wants to feel pain. And people who are in pain are taking medication for that. And with the Oxycontin, fiasco and the level of morbidity around the overdoses with prescription medication, the manufacturing has slowed down, the distribution slowed down. Well, people that were addicted to it, what are they doing? Well, they're going to heroin. They're picking up fentanyl. So yes, to answer your question, alcohol sales are up 60%. 2020 over 2019. So imagine what they're like now going into 2021. So, and I'm not talking about, I don't think people are celebrating what's going on. I think what's happening is they're home more. A third of San Diego lost their jobs, and we don't know what percentage of those are going to come back. They haven't yet. And the change that's happening at leadership is going to take a while to get settled in. And the coping mechanisms aren't that strong. And I know people in the healthcare industry that are experiencing relapse as well, because as a professional clinician, their role has always been to work with people. Well, they can't get to those people now. Those people can't get to them. So that's a huge void. I heard, just last quarter of last year that but a couple of different, psychiatrists, experts in the field, they took their own life. But they're human, and their whole world is, I call myself a homeless helper. I was, a hopeless helper, sorry, not a homeless helper anymore, but a hopeless helper. And I still help with the homeless whenever I can. It's tough out there today. And the fact that we're even talking about it, is unusual, because 2 years ago, we wouldn't be doing this. That's why the reduce the stigma idea, because I think that's one of the biggest barriers right now to getting mental health support, dealing with loved ones in your family that have substance abuse issues, people that might be addicted to prescription medication, people who might be using illicit drugs to supplement the prescriptions they're not getting anymore, and people that were casual drinkers that may have become abusive drinkers who now be, in a full-blown issue around addiction. So, and when I talk like this, I hear myself and I'm thinking, God, is it really that bad? Well, for a segment of society, it is. And what's fascinating, I learned just 2 years ago with this study, 15% of our country suffers from some form of addiction that will erupt over the next 12 months. Sex, food, gambling, internet, drugs, prescription, illicit, whatever. And now with marijuana being legal, it's opened up a whole nother Pandora's box. But 15% who are diagnosed with an addiction that will erupt, of those 15%, only 10% will seek help. Okay. But here's what's really scary. The 15% that suffer from that addiction that will erupt in the next year impacts 7 people every day negatively. So think about that. 7 out of 10 get impacted negatively. 15% have an issue. That's 85% of our country that will be impacted by somebody, or the person who's impacted, or they'll impact someone negatively. 7 people a day. And what I mean by that is, if I'm the active user, okay, and I've got a family and I'm acting out inappropriately, or I'm depressed, or I'm overusing, or I'm in a full-blown, inappropriate consumption of mood-altering substances, I leave the house, I'm impaired. It could hurt someone on the road. I go to work. I mistreat my loved ones and my friends. I'm not effective at work. I'm not effective at life, and I'm suffering. So people around me are. So when you extrapolate all of that data right now, we are in a perfect storm. And then you put the pandemic, obviously, envelope around all of us. That's tough. What do we do? How do we even manage that? What do we tell our loved ones? So my suggestions are, keep it simple, sit down at the dinner table, do a lot of listening if you can, and hear what people are saying around you, so you can maybe help them. Because if you're telling them what to do, they're going to drive themselves deeper into that rabbit hole, because that's where addicts like to be. And I'm speaking for myself. I'm not speaking for you. That was my experience. And that was a long time ago. So that's kind of a brief summary right now of where things are at. So anything that we can do to bring awareness, to talk about options and opportunities and help and hope is a great way to, at least I think, stimulate the conversation and know that, someone might be listening. I just spoke to a large group a week ago, and it was, I dared people to call me. It was a webinar, so I didn't get to see anybody, but it was, a live Zoom format. And I didn't hear anything from anybody for days. And I thought, God, that's so disappointing. And then, finally yesterday, I heard from someone early in the AM. This was about a group with young kids. It was the parents. And I was waiting to hear from somebody who had a child who was suffering. And it turns out that, somebody else was suffering, but it was the adults. So we're going to hopefully talk this week. But, that 129 people, only one phone call. And 15% of them are struggling somewhere, somehow, So I want to be a resource, Charles. And I hope that, I hope my phone rings off the hook. I like to say, I want to drink from a fire hose. So
Yes.
I say, bring it.
That's right. That's right. Well, Scott, I was looking forward to this. My mission, my passion is to hopefully not just instruct, but to motivate and inspire and hopefully bring back a transformation. I want to change paradigms and mindsets, but a big obstacle is addiction. And so you are the perfect person to have on this show. And there's no way I was going to have this show without interviewing you. Even if I had to just, hunt you down, I was going to find you. But anyway, Scott, I really appreciate that. For all of the viewers out there, Scott, I can tell you he's authentic. He gets results. What he can't do, he'll find someone who can help you. And remember, Ending the Stigma, A Path to Recovery. Be watching for that. His book, Tell Me No, I Dare You, I guarantee you, that was one book that helped me start my first book, The Fire Within, right here, right now.
By the way, did I tell you, not to interrupt you, but I am, did I tell you my new book's coming out in February, and it's called The Opioid Epidemic?
Opioid Epidemic.
Yep. And it's all about stories with families who have suffered, and hopefully a resource for families. February, March. And I've been working on it for, 18 months now. And it's an interesting topic. Then, of course, as you see my background, Scotty Silverman's Happy Hour, you can always Google that as well. And, find my name and number. And if you're listening to this or you're watching this and you know somebody that needs help, if you can't reach me, reach Charles, he can reach me. But I'm easy to find. And I challenge you to make a phone call, and what I'm doing for the rest of January, I'm offering 10-minute free coaching sessions just to get somebody jump started. And sometimes that's all it takes, is to point someone in the right direction. And if I'm that person that can help you, we'll talk about getting you engaged in coaching. And if I can be a resource to you and your family, I want to do that as well. And, to employers out there. And we just started working with veterans. Very exciting. It took me 2 years to get the insurance set up. And now we're helping veterans who suffer from substance abuse, mental health issues, PTSD, and we're hoping by spring of this year to start working with their families as well. So this is going to be I'm excited about 2021. Now that we're here finally, and the inauguration's tomorrow, I'm excited because I've been impacted too. And I like to think of myself as someone who's pretty resilient. And it's okay to be sad, and it's okay to, eat an extra piece of pie periodically, but I'm starting to get out and walk a little bit more. And I practicing self-care is really, it's not easy. And I'm a good example of that. I mean, if it was easy, we'd all be doing it.
Absolutely. Absolutely. Well, Scott, I thank you for being here today on the show. I know it took a little time, and I know you have some prior engagements. I know I have a couple of things I want to do also, but man, every time I see you and speak with you, I mean, I have questions. I like picking your brain. I like doing all of that. But for all my viewers who are out there trying to dream big dreams and something is hindering you, addiction or whatnot, get in contact with Scott. Get in contact with this crisis coach. He'll find a way, or he'll lead you to someone who can help you. Thanks for being here on the Fire Within, Dream Big Dreams. Thank you, Scott.
Thank you, Charles.